Hello everyone, thank you again for joining us. We are so excited with an amazing show with incredible information. So Maria and Gina,
I'm back.
my business partner, my partner in crime is back. I am so happy you're back.
I missed you guys. I missed you guys. I missed the show.
Yes.
Watching the show from Italy, and it's when she does it, it's 12 o'clock at night, and I'm staying awake just to watch it.
Well,
She
it's
did
so
go without me.
I'm so happy to have you back. I missed you so much. Reflect and Reset with Maria and Gina, and you know our mission is to bring to the community information that is valuable, that could make a difference in your life or anyone in your family. And we're here with an amazing show, and Gina is going to tell you exactly where we are.
Yes. So we're actually filming from the Cabrini Nursing Home, and we're here with Archcare. Now, Archcare is something that everybody's going to need to understand, because this is going to help so many people that don't know that you exist. There's one program within Archcare that we're going to discuss today, and that's the PACE program. And the PACE program is for 55 and older. We'll get into it about exactly who qualifies and what exactly the PACE program does. But first, let me introduce our very special guest.
Yes.
So we have Henriette Kole, who is the Vice President of PACE.
Mm-hmm.
We have Ellen Glaskin, and she is the Program Director. And then we have Lois Cartiz is fine too. Kartika, sorry.
I like
and
Cartiz,
she's,
actually.
and she is the director of the wellness center that we're actually filming from. So we're going to get right into it so everybody understands what exactly the program is. So can you give us a quick understanding of what PACE actually is?
So PACE stands for Program of All-Inclusive
A little louder.
Care for the Elderly. There's 400 PACE programs in the United States. This is one that's affiliated with the Archdiocese of New York. And PACE is a program that is a provider of services and a payer of services. So a provider and an insurance company. And that's a unique combination because it allows us to make decisions about care based on payment of services. It gives us the incentive to keep individuals in the community and not with expensive hospital stays or emergency room visits or institutional stays.
And you talk about a wellness concept, that is not just about medically trying to handle the patient and deal with the medical needs, but more of it, I call it a holistic, but
It is
holistic.
It is, exactly
holistic
that.
way.
Yes.
So can you elaborate on that?
So there are three components that make a PACE program. There's a clinic, which is it's an Article 28 clinic. Think urgent center, like all treatment rooms, doctors, nurses, NPs. There's a home care program, which you don't see, which are a full home care staff that goes out into everyone's home, including the doctors and the nurses. And then there's a wellness center. I'll let Lois explain it. She's a director of the wellness center, which is optional if people want to come into the wellness center, not required.
So Louis, can you tell us a
Yes,
little bit?
of course. So the Wellness Center, although it is optional, most people who enroll in PACE really, really like to spend time here. And we have individualized schedules for people. We're open here at the Wellness Center Monday through Friday from 8 a.m. to 6 p.m. So people who attend here have the benefit of enjoying 2 nutritious meals, breakfast and a hot lunch with meal choices, and a really wide range of activities with the focus on health and well-being, and it is a very holistic approach. So we have discussion groups, we have a variety of exercise programs, we have yoga, Tai Chi, we have art therapy, we have pet therapy, we have Reiki circles here. So we do trips, we have parties. It's really a place of great enjoyment, and we approach it with a mind-body connection. So people leave here feeling great, they feel enlivened, and they've addressed their physical, their psychological needs, joining in all of these spirited programs, and also socializing with each other. There's a lot of camaraderie here among the participants.
And many individuals don't have families.
Exactly.
So we really do become their
Wow.
families.
We are their family.
We have Thanksgiving dinner, we have Christmas dinner, we have, just a place where people can feel
Now, who's
connected.
eligible? Who's eligible? And am I eligible?
You have to be 55 years and older.
Okay.
So I don't know if you're.
Are you-
I
You
am
don't look
eligible.
eligible.
Hey, let's not know this, but I'm eligible.
You have to have Medicare, of course, 65 and older for Medicare, Medicaid, or eligible for those services. Some people do. You can have Medicaid only. So if you're 55 and you don't have your Medicare yet, because you have to be 65, you can join. Some people do pay privately, so it's a mix.
So this is in lieu of Medicare.
So we become Archcare Senior Life, which is the name of our PACE program, becomes your Medicare and your Medicaid. So in your wallet, you have an Archcare Senior Life insurance card.
And that's 100% covered, not
100%,
80%,
no co-pays,
20%.
nothing. So we are your Medicare A, B, C, D, and your Medicaid. So when you go to, well, actually, your drugs are delivered wherever you want them. To your home, to here, your nurse will bring them. And the good thing about that, besides the delivery and that it comes on a cycle, is we also have an ATM machine here. Doesn't have money in it, has medicine in it.
Okay.
And so if you come and you need the first dose of your antibiotic or the first dose of something, you punch it in because we have an electronic medical record. The doctor orders it, and you can go home with what you need, and then it'll come to your house, the rest of it. And it'll come any way you want it, in bottles, in what we call bingo cards, if they're individual, or now in New York you're able to get little bags. So you can get a little bag of your morning pills, a little bag of your afternoon pills, so you don't have to worry about, popping them all out.
So it's not necessarily somebody who is disabled.
No.
It's somebody who qualifies for these services, and then what you're doing is as we age, you're keeping us healthy.
So think of a bell curve. So we want people on all the parts of the bell curve. We want people that are healthier. We want people that have chronic needs. And then, of course, we get very sick people who come across the service with all kinds of reasons. So because we try to keep the program on a bell curve, it keeps the expenses in flux. So I get a certain amount of money every month to take care of you. And depending upon your needs, that money is spent to keep you home, wherever you call home, and out of institutions and hospitals. So if we have enough healthier people, it's supposed to balance out. Of course, we take everyone, and everybody does have very complex needs, but we coordinate their care. And once your care is coordinated, your needs tend to lessen because, as you well know, people out there have all kinds of practitioners that don't really speak to each other. So they're taking all kinds of medications from all different people, and there's no one coordinating
And
their
they're
care.
ensuring that they're doing things correctly and they're following their appointments and
Correct.
they're taking their medication.
And we're transportation, we have our own fleet of buses. So
Our friend wants to say something here. Tell us about the bird, actually.
Okay. So Tutu is
Tutu.
an African parrot who is a member of our PACE program, an honorary member, who the participants love. I think she's been here a long time.
Yes,
She's
very
been here a very long time. She actually belonged to one of the sisters who is up in the nursing home who had a whole bunch of birds. This is the last, and as you know, if you know anything about parrots, they're probably older than all of us. They live a very long time, but very enjoyable. She comes out of her cage. She is entertaining. When there's music, she makes everybody laugh. But it's part of the program. Pets are very much a part of everyone's
You
life.
know what was beautiful is before we went live, we started talking a little bit, and it's not just healthcare, and that's what's really important because you were saying that it's really based on the patient's needs.
Correct.
So maybe you can just explain.
Sure. So when we put a plan together, in healthcare, it's a lot about what the healthcare practitioners think you need. They want you to follow all these rules. Here we call it your life plan, because we're not here to really change your life and make you do things with your diet and your activities and everything that you've done all your life. That's not a successful way to be a partner. So what we try to do is be realistic with our expectations, because healthcare people are very, you have to,
Yes.
right?
Wow.
You know that. So we try not to do that so
You're
much.
so right, because somebody at that age, like, I really, after 55,
Leave me
65
alone.
years,
Right.
like, are we really gonna make a serious
Right.
impact in
Right.
changing
Right.
their habits? So I love that, that you can sort of work with the habits and try to do the best that you can with them.
And
And we-
go ahead.
And we meet as a team, an interdisciplinary team, with the participant to see what we do it the first month they come on, and then at least every 6 months, and many times in between if they request it, to see what their needs are, what it is that they want out of the program. So it's not us telling them what they should do, it's us working together to meet to meet the needs that, and the goals that they have for themselves. So we've even had someone that wanted to take a college course, and we helped them take an online course, because that was a goal they had. They wanted to complete a course, so they did it online, an
We've
online
had
course, yeah.
people become citizens, which we've really celebrated. We celebrate 104-year-old birthdays.
Oh, wow, that's
You know, we
beautiful.
really, the range is and the differences with the participants are really what makes the program so cohesive, because they enjoy the differences with each other and they learn from each other, and they learn celebrating holidays that they wouldn't get an opportunity to. So
You know, one thing that I loved about coming here, I love the fact that you guys are trying to help people stay home. Because when you go into a nursing home, and there's a place and a time for a nursing home, and I understand that, but there's a little bit of the dignity that you feel that you're losing, right? Because you're losing your identity, like your home. And the fact that you try to do everything possible to have the patients stay home and assist them. I can tell you personally, my grandmother, I took care of my grandmother. My grandmother lived until 96. So hopefully I follow her footsteps. And
We all.
I did everything possible to take care of her in the house. We're Latinos, so, you know, especially in the Latin culture, I mean, putting a patient in a family member in a nursing home, and I can tell you the story with my grandmother. I was going to have to, because I was raising 2 little kids, and it became so much for me to be able to manage her care, and she needed 24-hour care. And I remember taking her into the nursing home that I was looking to put her in, and she looked at me and she said, I could not believe that you, my beautiful granddaughter, would put me in a nursing home. I turned around and I brought her back to the Dominican Republic, and she lived 4 years there, and she was very happy, but we kept her home. And I strongly believe that she lasted so long because she now had a home where people came to visit her, and it was very interactive.
The environment.
Right.
And that's why I love, and we wanted to come here because we could choose other places to go. And I actually ask you, what makes you different than at another HMO insurance company? So,
Well, our sponsor is not for profit, so we're not for profit, which means that profit is not our main goal. Whatever we make as a surplus, which is government program, so it's not our money, we put back into the program. And we are sponsored by the Archdiocese, so the mission and the values that are familiar to all of us are very much part of the program. And we see that in the people we hire, in the way the participants and the staff interact. It's an expectation that there's a value in a mission statement. I'm not saying that an HMO may not have that, but that's a business.
Right.
Here, we're a program, we care, we touch you, we take care of you, our staff are care providers, and we pay your bills. We don't
Exactly.
pay your bills, this is your copay, this is how you get to this doctor, we make the phone call, we pick you up, we send someone with you if you're alone. If you're sitting at the doctor's too long and you're hungry, we have food with us for you. If you are maybe not able to be quite as competent, we have all kinds of information that the participants we call them participants, because they participate in their care, right? Bring with them. We have people that are developmentally disabled, so they have little stress bags that they bring with them, so they can manage that weight and not have to leave the appointment. And people ask, well, do people go on hospice? So we are your everything. We joke that our staff probably has done more eulogies because we're so involved with the families and there through the last days. And I think that's what makes us different. That's not what I think of when I think of an HMO.
And it's also not just the medical aspect you were telling us.
Correct.
So yes, they assist you, yes, they come with you, yes, but if you need anything, if you're a member with this company and you need anything, if you're depressed, like you said,
Correct.
you'll get them a dog.
Right.
I mean, this is an over and above kind of
If you
facility.
need to get to your services, your religious services, if you want to visit someone, there's an awful lot of people that are alone and lonely. So that's something we focus on. What are we doing for people that are lonely? Because if we don't see them, we still know they have needs. So I do think, and that's the social aspect. What if they're in the hospital and someone needs to walk their dog?
Yeah.
Or they're worrying about their pet, and that's why they don't want to come and get taken care of. There's all those little things.
So
That
you
you
actually work on those?
Yes.
Wow.
We work on all of those. We work on all of those issues, and I think the social aspect goes beyond. It's more like the social determinants. We understand the culture where our programs are. We have a program in the South Bronx, a program in Harlem, one in Staten Island. Very different. Their wellness needs and centers are very different. Yeah, they're driven by what the.
So you're saying that the archdiocese, but this is not faith driven. They could be. Do
It's
they have to be
faith-sponsored.
Are
No.
they have to be a Christian? No. It can be anything.
We accept all things.
It's sponsored, not required. It's not a Catholic program. It's a Catholic sponsored program.
And I want to give the telephone number. So the number here at PACE, the Archcare.
It's for all the PACE centers.
Is for all the centers is 866-263-9083. So if it's you or someone in your family or someone you know that could benefit from these services, you got to pick up the phone and call and learn more. Because there's so much,
Absolutely.
we're just touching the
Right.
tip of the iceberg,
Right.
but there's so much more that you guys do.
And there are times when people call just to talk.
Yeah, that's what I was gonna say.
Yeah.
And if anyone's interested and wanting to know if this is the right program, you can give us a call. You're welcome to come here with your family or by yourself and spend the day. See
Have
what it's
lunch,
like.
visit.
You spend the whole day visit, do the activities, and we'll provide you transportation from your home here so that you could attend
You
and
can see
enjoy
what
the
it's
day.
like.
Really see, because you really have to see it in action to understand it. It's a great program. It really is.
We have a lot of followers on LinkedIn too, and there are doctors that might be listening to,
So,
what we're speaking about.
Yeah.
So can you explain if, because I know we're
Yeah.
looking into getting into the
No, we
network.
are. We are in
Oh,
network.
we're actually, we're in the
We're
network.
a network. So
Right.
Dr. Middleton
Correct.
and our doctors are now providers
Right.
under this network.
And what it does for, let's say, a physician practice is, the physicians see their patients regularly. They don't have lots of time for them because they have lots of people to see. But as people age or their needs get more developed, we're sort of that safety net for them because all the doctors know who's not going to come because they don't like to go out in the rain, or who doesn't want to worry about getting a taxi, or who's really going to go get their medication, or maybe wait till they have a little bit more money. So we're the support for a physician practice that kind of takes care of all. We know that the daughter's overwhelmed. We're going to give her some support. We do have support groups for families, for all kinds of dementia, Parkinson's, all kinds of things. So it's not just the patient, it's the family. And I think that's the piece, knowing so many doctors so well, after being in healthcare for so many years. We're that extra bit that we can do. We can extend his care because they just can't take that kind of time with every patient that they have.
And I was telling Maria on the way here, my dad passed away from stomach cancer, and it was difficult because before we got care for him, we were the caregivers, medical caregivers. And it's not a good place to be for family members, and that's why this is beautiful. Because you take that responsibility, per se, out of our hands, and now we could be, as you said, the nurturer.
Well, then
and the loving
you're
family.
back part of the family. And I think we've all been, I mean, I was caregivers for my parents also, and it's not a role that, you know, when you have to keep switching roles, take your medicine, but I know you don't feel.
Because they start looking at you
right.
differently, like,
Yes,
shut up
course.
and get away from me.
Yeah, right.
You know?
Right. I know, my mother always
Yeah.
used to say, leave me
Yeah.
alone. You know, and you don't enjoy them on the level that you want
Right.
to enjoy them. And we can give that support. You don't have to be the gatekeeper for medicine, for appointments. And that takes a lot of stress off, and that stress is what deteriorates a lot of family relationships with someone who comes ill.
You're absolutely right. I mean, we actually, last week, we did our Facebook Live in Alzheimer's, with the Alzheimer's Association, and dementia was something that, you know, we were talking about how that debilitates a family. I mean, to be able to deal with your loved ones that have dementia, and you're saying that your program will assist families. And would they assist them at home or?
Of course, so.
Is it round the clock?
It's round the clock, yes. So we provide live-in home health aides. We provide different hours of home health aides depending upon the need. And of course, relief for caregivers, even if it's just, especially with dementia, because we work with the Alzheimer's Association very closely. But sometimes someone just needs to get out for a few hours, right? Get their nails done, or see a friend, or just be alone for a little while. It's very draining, and caregiver stress is a very real, it's a very real thing. And a spouse, you're watching someone you love deteriorate. It's very sad. So I think we're really strong support for those, because we get it.
That's great.
You know.
And in keeping with wanting to keep people out of the hospital and nursing, on the weekends, we do have nurses, if someone calls and they're not feeling well, we have nurses that work on the weekends that can go to somebody's home, either a planned visit because we know someone just needs to be checked on, or they can call our answering service, which is a nurse and a doctor on call.
Right.
You get a person, and we send a nurse to your house to visit with you. So you don't have to run out to a hospital, might not be necessary, and we'll have the nurse evaluate you.
And actually, what we had learned also was that for our office, and I'm sure for other offices, once the doctor maintains a certain number of Archcare patients, that you actually provide help in our own practice.
Absolutely.
You send
We
a
have
nurse
a nurse-
practitioner
yeah,
to
from
come to us
from the very beginning,
and
actually.
help us
Yes.
control and
Yes.
monitor and coordinate the care of
Right.
those patients.
Because this is a team-based program, and it's the doctors, we want doctors in the community to be part of our program, but we need a liaison, who we use, which is a nurse practitioner, who can say to the doctor, you don't have to sign 500 papers. You tell me, I'll tell the team, we'll communicate that way. It's much cleaner, and everyone gets to know that liaison, and then it's more of an enjoyable experience for the doctor. It doesn't just become a chasing papers, signing thing. We want them to be part of the care. So I think that takes pressure off the doc too.
That is awesome. I can tell you that coordinating care with the providers, I mean, like you said, a primary care doctor, it is impossible to expect that he's going to be able to manage everybody that has chronic conditions, and they have a lot of chronic conditions. So being able to have a care manager or nurse practitioner that is helping you, I mean, that's tremendous. I can tell you that, I'm in my 50s, I think, most of us are. And at this stage, we are dealing with the fact that our loved ones, our parents, a lot of them, if we are blessed enough that they're still alive, they're going on this path. Unfortunately, that is the path is the reality. We get older, and we could get dementia, or we could get conditions just aging. And to be able to know that they are, there's an organization like this program that is there to support you. Now, let me ask you, so if I have Medicare, and then I have a secondary that is not Medicaid, could I give you know,
Give
what
up.
I become?
So the eligibility and provider people work with all kinds of secondary insurance and make it work. There isn't one answer to that because it depends on what that insurance covers, but in most cases, the secondary works with us also.
So usually you're Medicare or Medicaid secondary. Is that-
Medicare and Medicaid secondary, but if there's an additional insurance, that can become secondary, and Medicaid can pick up what's not. So the good thing about being in the insurance company is that there's a whole group of people that work through that eligibility. So you don't have to be faced with, I have to do this application, or I have to
Right.
understand my mail, or
Because the 20% secondary costs the patient money.
correct,
So
but
are they able to drop that and
they
keep you
can,
as,
they can.
I mean, right there,
They're
the
not
savings.
paying, once they come onto our program and they've met the eligibility, they're not paying any bills. They're not paying, and if
That's
someone
amazing.
needs Medicaid quickly, let's say they're eligible and they're living alone, and there's something called a pooled trust, which gives you Medicaid overnight if you agree to put your money into a pooled trust, and then the pooled trust pays your bills out of that pool of money. And there's many pooled trusts, but it's a different way if you have an immediate need and you have to get in and you don't have time or family or friends to do all that Medicaid work for you. So there's lots of different ways to become eligible.
What do you think the biggest challenge that you're seeing with the elderly population right now?
I think, well, there's, yeah, a
Dementia.
lot of
Dementia.
people are living very, very long. So their chronic illnesses live over that long lifetime with them. Most people with dementia don't have a lot of chronic illnesses.
Right.
Sometimes that's really their issue. And they're very healthy and very hard to manage. So,
And coming here really helps the families a lot. I mean, we have a lot of people that didn't know what to do with their spouse. You know, they were home with them and it was very hard. And they come here and they spend the day and it's such a relief for them. Dementia is very hard for a spouse to handle. So we really try and work with them to help them along.
I think the other issue that we see is the chronic condition of loneliness and
Yes.
isolation in our elderly.
Yes.
And how that impacts their health in a very negative way.
Correct.
And once they come here and they're able to socialize with their peers and be in a comfortable, nurturing environment, they really start to improve very dramatically. You know,
Well,
physically
it's
and
a great way of ending because unfortunately we're done. 30
Is it
minutes.
already?
It just, yes.
Let's keep going. It doesn't matter. I'm back.
But loneliness
Yeah.
for the elderly, it's something that is a huge problem. And I know that when I was talking to the Alzheimer's Association, Jessica, who was wonderful, we talked about that being active, being able to listen to music, being able to keep your body active is something that is so important as we are aging. So the work that you're doing is commendable. Thank you so much for being here for the community. We are all about our community.
Let's just give the number again, real
Yes,
quick.
absolutely.
So again, it's Archcare, and it's 866-263-9083. So if you know anyone that could benefit from these services, pick up the phone and call, and just get information.
Thank you so much,
Well,
ladies,
thank
for
you.
joining us.
Thank you.
And thank
Thank
you
you very
all.
much.
Remember to like us.
Yep.
Take care. Bye-bye.
Good night.
Bye.